I'll record this and then we're going to move down to the floor. I'll just move those out of the way. So, one of the things that happens when we have any discomfort or any significant amount of pain is that we tend to elevate the rib cage up, and we sort of end up with the ribs kind of flaring upwards. And so when we're breathing, we tend to breathe more into the upper chest and not so much into the abdomen. And the problem is that the rib cage kind of gets stuck in that position. And so if you put your hands at your rib cage and you really lift your rib cage up, you can then feel that that adds to you having a lower back curve that is bigger. And the other thing that it does is it sort of, if we put one hand at the lower abdomen and one just underneath the rib cage, if we let it go back down towards the mat and then we lift the rib cage up again, you can feel that the space between your hands is a little bit longer. So it means that the abdominal muscles have to kind of work extra hard to even get a contraction in the first place, because they need to be able to pull the rib cage down, and then they need to go that little bit further to tighten. And so sometimes when people have core strength issues, it's not actually a core strength issue, it's actually a breathing issue in a rib cage position. But if you think about it, when we talk about it, when we're going up into standing, about how the pelvis tilts to create a bigger arch in the lower back, it could be that you're doing lots of work trying to roll the pelvis and work on it that way, which is how I would have typically asked people to do it previously. But the one thing that can hold you back is actually the rib cage. So if the rib cage is staying stuck upwards, it's really hard then to flatten the back properly. So we're going to work a little bit with that. So all I want you to do is put your fingertips really lightly on the rib cage and just breathe in through your nose. And as you breathe out, try to get the rib cage down, but you're gonna feel like you're tilting it that way. So it kind of feels like it's lifting behind your neck, but dropping down where your fingertips are. And so just do a few breaths there. And try to keep the rib cage down when you breathe in. One more breath. Now, the other thing that happens when we get the rib cage down, where we want to take our breath to is actually into the diaphragm, into the lower abdomen, because if we're breathing into the upper chest, none of this is actually getting any work. And so when the rib cage is elevated, it's really hard to actually breathe into the abdomen. And so if you've ever worked on that before, sometimes other classes like yoga and things like that teach this way of breathing through into the tummy. So if you want to get the breath down into that area, the rib cage really needs to be down. So if we lift the rib cage up and try to breathe into your tummy, it's possible, but it's probably easier if we get the rib cage down. So now push the rib cage back down to where you were with your previous breaths and try to breathe into the tummy again. And so in some ways it feels a little bit harder because you feel like you're kind of fighting yourself. You really want to lift those ribs, but the reality is that we should be able to keep the rib cage down relatively and still get that big breath into the tummy. Yeah. So if we just take that big breath into the tummy now, and just do a few there. So you guys keep working on that. I'm just going to mute everybody so everyone can hear. So if we just keep working on the idea, and if you're sitting down doing this, you can still have the hands on the rib cage and just feel like you're pulling down towards your hip bones, which is going to give you a slightly flatter curve in your lower back. And so one more breath. Now, if we turn to our side, come up from there into standing, and I just need to adjust the screen. A little bit more even. One of these days they'll invent something that gets the whole body in. So, right, when we come up into standing, so now we're thinking about that rib cage staying down. If we take the right leg forward and the left one's back on the floor, And we start to drift forward, bending that front knee, allowing the back heel to lift off the floor. And so if we just keep our hands on the lower ribs and we want to sort of stay down a bit with them so we feel like this space is a little bit smaller rather than really lifting up. And so inhale as you go back and exhale as you go forward. And so as you go into the front foot, just make sure that you're feeling the tripod on the floor. So you've got the ball of the big toe, the ball of the little toe, and the heel, and that knee is bending because the body's moving forward. We're not doing a lunge. And so we want the back leg to stay straight. And so we want that feeling of leaving the back leg and going into the front leg with the rib cage down. And so if we have done this before, which most of you will have, sometimes people feel like they're getting a bit of a nip in the lower back. And if we can keep the rib cage coming down, then that limits the amount of nip that you get in the lower back. Now, if we want to try and get a stretch through the front of the back thigh, because if the pelvis is tilting forward, chances are we're slightly tighter through the front of the thigh than we are in the hamstrings. Most people will feel the hamstrings feeling tight, but the actual problem is that the hamstrings are lengthened already and tight. So when we go forward, we want to tuck the pelvis under on this back leg. The front one's going to be going forwards, the back one is tilting backwards. And so if we can keep our rib cage down and kind of tuck the pelvis under on that side, it should give us a nice big stretch through the front of the thigh. And so we're just going to work with that for a bit. And so a lot of the things we do in life keep us in a 90-degree position at our hips. And so if we're sitting for long periods of time, chances are we need to get into this area and let it open. And so we always want to make sure that the rib cage and hips feel like they're stacked on top of each other and the head is on top of all of that. So we don't want to lean into it with any one part of the body. Think about a runner crossing a finishing line. There always is a bit of them that's kind of sticking forward, trying to get through that ribbon first, but we're going to try and do it all together. One more. Now, if we have the same idea, but switch the legs around, so keep the fingertips just on the lower ribs and just take an in-breath here. And on the out-breath, try to get the rib cage down a little without feeling like you're bending forward. Now, you may feel like you're bending forward, but you're probably not. So it's just that we're probably used to being more upright. So rib cage down and drift forward. So inhale as you go back and exhale as you come forward and drift slowly into that front foot. And as you come forward, start to tuck the pelvis under on the back leg, so on the right hip. And so as that pelvis starts to tilt backwards, we're starting to get a little bit more stretch through maybe the inner thigh, maybe front of the thigh, but definitely on that back leg. And so one of the things I talk about a lot is lifting the breastbone up. Now we can lift our breastbone without lifting our rib cage, which probably feels pretty impossible, but it can happen. And so rather than the rib cage, when we start to think about lifting the breastbone up, what we want to feel is that the rib cage stays back. So it's going to lift upward, but it needs to stay tucked in. So we're going to start integrating that idea a little bit of lifting the breastbone up as we come forward. Now we're going to change it to an in-breath to help with that. But you still want to feel like your rib cage is going back and in. So we don't want a big push out into your fingers. And some of this feels like you're really fighting yourself, but it will get easier. And there will be more movement there. It's just that because of the position the rib cage has been in, it feels like you're pressing the brake and accelerator at the same time. So one more of those. And just bring yourself back to stand and arms just hanging down at the sides. And you should feel like the lower back is reasonably relaxed. If we get the rib cage down, then that decreases the amount of curve that we've got through the lower back. It also allows the front of the hips to open up. So you're just going to take a little walk around the room now and just see how you feel. Now, when we open the front of the hips up, it can relieve an awful lot of tension at the lower back, and you just start to feel like you're a little bit taller, a little bit longer, because you've now got that openness here where we had a fold. So the hip flexors that come in off the spine and down to the front of the hip, if we're sitting and our hips are flexed, it tends to hold us in that position where this angle is closing up and it's like this. And so when we go to stand up and we open that angle up, the problem is that if these muscles have been allowed to stay too tight, it tends to pull us forward into more lower back curve because the hips are really powerful and they need to open to stand us upright. But we feel like we're being slightly pulled forward into a more of a lower back position. So that's one half of the story, is starting to get that more open. Now, in order to hold that position a little bit better, we need to activate our hamstrings. Because remember when we talked about the pelvis drifting forward, that would mean that the hamstrings were being lifted up in the back. And it might feel like there's tension there, but the tension comes from that there's length. So imagine you had an elastic band and you're pulling and pulling and pulling. There's all kinds of tension there, but does it need to stretch any longer? No, it needs to come back into a better length. So we need some give to it. So I'm going to take the right leg forward and left one back. And as you roll onto your heel, we're just going to push the hips back and lift the toes up. So I'll just turn to my side here. Now, so we keep working on that idea with the rib cage. Put your thumbs at your rib cage, fingertips down to the hip bones. And so when we start to tip back, feel that space getting really small, but keep the head up. And then stand up. So inhale here, exhale, go back. Inhale up. And exhale back. Inhale up. And exhale back. One more up. And take it back. And then just switch to the other leg. So inhale here and exhale back. Inhale up and exhale back. And so we're really lengthening the hamstrings and asking them to snap back when we stand up tall. Inhale, bring the hips forward, stand tall, and then really close down ribs and hips. Two more. And up. Now, just take yourself again for a little walk around the room. See how you feel. And if we bring ourselves back into standing, feet hip distance apart, and just hands at the hip bones, just allow the right knee to bend so that hip drops down and straighten back up, and then left and straighten back up. And so as we bend the knee, we're flexing at that hip, extending at the other. And because we worked a little bit with the side to side movement, so when we start to do this, we want to focus in on whether we feel things happening in the lower back or in the front and back of the hips, but also what's happening at the side. So continuing on from what we were talking about last week, when we bend one knee and we push into the hip, you can feel one opening and one closing. And then when you switch, it reverses. And so we may have one side of the hips in the glutes that needs sort of opening up a little bit more. But If you're doing this, just make sure that you keep that connection between the ribs and hips. So just take a breath in and then out. Let the rib cage drop down a little. Hold your fingers there and go through the movement again. And so you're going to feel one side opening and one side closing. And so if the rib cage stays in a better place, so just feel if this feels different compared to what we did a minute ago before we kind of reset the rib cage. And so when we're under stress or pain and the rib cage really lifts up, then what we need to do first is get it down. And that really makes a difference to how everything feels overall. Once we reset that position, we're better stacked over top of ourselves. So the rib cage is over the hips are over top of the feet. So let's pause there.